Welcome to the second installment of my video series focusing on alleviating menstrual discomfort. In this episode, I aim to share real-life accounts of the excruciating experiences encountered by some women, which might be beyond the imagination of many medical professionals and the general public. My intention is neither to exaggerate nor to trivialize these experiences but to faithfully convey the descriptions provided by the patients themselves. For instance, one woman described her entire body feeling so sore it was as though she had been run over by a bulldozer. Over 7 years, a narrative unfolds that is less about exploration and more about endurance. At the heart of this story stands a 22-year-old woman, whose life's rhythm is governed not by the calendar but by a cyclical turmoil, both physical and emotional. In the days leading up to the storm of her menstruation, a prelude of pain sets in, a profound, gripping agony in her legs, serving as a forewarning. It is more than mere discomfort. It signals an impending weakness, a draining sensation that particularly affects the back of her thighs, radiating downward and intensifying with each day until menstruation begins. As the calendar pages turn, emotional upheaval precedes the physical. Uncontrollable tears, a flood of distress that overtakes her without warning. Depression and anger, those dual robbers of joy, cast a lengthy shadow, darkening the days before her cycle. Her lower abdomen twists and contorts in pain, a soreness so intense it feels as though she has been run over by a bulldozer, a sentiment echoed in every aching bone and sore muscle. Amidst this, her body rebels further, plunging her into a vortex of nausea and relentless vomiting. Seeking refuge, she turns to tablets, desperate to quell the internal storm. Yet, even amid the tempest of pain and emotional turmoil, moments of fragility surface, revealing vulnerabilities not just in spirit but also in body. Dizziness, a treacherous companion, leads to falls, especially under the harsh glare of sunlight. This story is not merely a tale of suffering, it is a call for understanding and empathy. It serves as a reminder of the silent battles and unseen challenges that menstruation can amplify for some. It highlights the strength required to face each day and to continue despite the pain and emotional toll. This narrative is not only about one woman, it echoes the experiences of many, hidden yet profoundly real. The next example involves a middle-aged woman in pursuit of having children, enduring unimaginable suffering and experiencing unthinkable losses. She was tormented by twisting pain and localized aches that rendered her completely blank. For years into their marriage, the couple embarked on a journey to have children, which led them to seek infertility treatment. The woman conceived but soon after developed pain on the right side of her abdomen. A laparoscopy revealed a ruptured tubal pregnancy, necessitating the surgical removal of the affected contents. After continuing with infertility treatments for an additional year, she again suffered from abdominal pain, which was diagnosed as adhesions around previously removed tube and treated surgically. Subsequently, she experienced pain on the left side of her abdomen, and it was discovered that she had another tubal pregnancy on the left side, which was also terminated. These medical challenges were followed by an onset of severe and novel pain associated with her menstrual cycle. 2 days before her period, she experiences sharp pain in the front part of her thigh and the undersurface of her heels, more pronounced on the left. By the next day, an unbearable pain emerges in a small circular spot on her left buttock, challenging her ability to sit or lie comfortably, severely hindering her ability to sit or lie down with ease. As her period commenced, she was afflicted with twisting pains in the lower abdomen, below the umbilicus, fluctuating in duration from 2 to 15 minutes. This intense, bewildering pain, which intensified during and lingered for 2 to 3 days post-menstruation, left her in a state of shock and confusion. She had to take leave 1 week every month until she could no longer bear it, leading to an unthinkable decision to leave her job. This is the reality for some, hidden yet profound. The next example is a 48-year-old woman's saga of pain as if her insides are turned over by a shovel. Every month, a storm brews within me. The relentless pain, like a shovel digging deep, twists my insides. Each throb, every 10 minutes, a reminder of the battle within. Head sweating, flatulence, headaches, a symphony of discomfort. But I endure. As my period arrives, the pain peaks, mirroring the flow. 2 days of agony, then relief. Red and black, the aftermath. Yet, amidst the storm, a ray of hope. Natural remedies, my saviors. A journey of resilience, a monthly trial conquered. I found peace in the chaos. A 28-year-old individual experiencing infertility and polycystic ovarian disorder (PCOD) reported symptoms including menstrual cramps in the lower abdomen, back pain, and discomfort on the outer side of the right thigh, as well as internal pain resembling the sensation of being struck with a hammer. Additionally, the patient suffered from severe nausea coinciding with the peak of the pain, emotional disturbances such as anger and depression, sore and sensitive breasts, and food cravings. Furthermore, the individual observed the intermittent expulsion of clotted, dark blood following cramps. Remarkably, after treatment with natural remedies, the patient was completely relieved of all symptoms and joyously became a mother 2 years later. For 25 years, she lived a reality most can barely imagine. Pain so intense it mirrored labor became her unwanted constant companion. Despite her cries for help, the response was disbelief and dismissal. "It's all in your head," they said, a phrase echoing the corridors of countless medical offices. This isn't just a story of suffering, it's a stark look into how easily a voice can be silenced by misconceptions. Today we shed light on her journey, not for sympathy but as a call to action. Listen, really listen to those who come to you in pain. Awareness is the first step towards change. Since her college days, she has experienced severe menstrual pain, often spending the entire day on bed due to discomfort. Preceding her periods, she suffers from headaches, irritability, extreme anger, nausea, and breast pain. Her breasts become red, hard like stones, and painfully sensitive to touch, especially on the left side, accompanied by depression and vertigo. She also has a craving for sweets and experiences flatulence. During her menses, she notes that her urine turns a dark red color. Before her periods, she feels pain running in a straight line from her umbilicus to her urethra, as if a blunt needle were being inserted through her umbilicus to her urethral orifice and then pulled outward. This sensation is intermittent and can last up to a week after her periods end. Additionally, she experiences uncontrollable sexual desire before her periods, to the point of obsession, which subsides once bleeding begins. This is the story of a 36-year-old woman who endured 24 years of suffering. She first experienced menarche at 12 years old, her periods from that age marked by bodily pains similar to pre-fever symptoms and a feeling of heaviness on the first day. Her mood changes dramatically, particularly showing increased anger 5 days before her period, accompanied by a white, transparent, and yellow vaginal discharge that subsides once bleeding begins. Additionally, she develops pimples before her period, which disappear afterward. Every month, she experiences severe, twisting pains in the lower abdomen, primarily on the left side, that are unbearable and often accompanied by vomiting, weakness, and back pain that feels both hammering and burning. Previously, she managed the pain with Voveron injections, which reduced in severity after childbirth but worsened again over the past year, leading her to take analgesics every month. She also suffers from severe constipation during her periods. However, after taking her constitutional remedy, her next period was painless. The cramping pain begins in the lower abdomen on the right side approximately 5 to 6 days before her menstrual period, reaching its peak intensity. The pain diminishes in intensity to about half once her period starts and subsides completely 5 to 6 days after her periods conclude. This drawing pain extends from the right side of her abdomen to her genitalia and gets a sensation as if parts come out. Additionally, she experiences pain in her vagina when urinating or during bowel movements. The discomfort is more pronounced when lying on her left side and lessens when she lies on her right side. For the past decade, a 21-year-old college student's life was overshadowed by health challenges, peaking just days before her menstrual cycle. Imagine enduring a pain so specific it draws inward from the lower abdomen, right side, intensifying as the days pass. This pain, along with a storm of mental irritation, anger, and depression, would slightly ease with the onset of menstruation, only to be replaced by back stiffness and a peculiar craving for dry rice. The premenstrual pain also used to be associated with headache again on one side along with sleeplessness. But the most unusual part? Her nights were haunted by dreams of snakes chasing her, only never to bite her but the one beside her. In a twist of fate, a single drop of an ultra-diluted medicine derived from snake venom brought an end to her decade-long ordeal. This unconventional remedy, which conventional medicine struggles to grasp, addressed not just the menstrual pains but all associated symptoms, offering her a new lease on life. This young girl experiences significant swelling of the face and body commencing before menstruation. This swelling makes her feel heavy and remarkably subsides 4 days post-menstruation, demonstrating a noticeable transformation. Despite the apparent changes, no conventional investigations have pinpointed the cause, but for understanding her constitution. She begins to feel bloated around the abdomen and face 7 days before her period, with these symptoms alleviating once bleeding commences. By the 4th day following her period, she feels a significant reduction in swelling and lightness. Additionally, she encounters 1. Excessive crying beginning 1 day before menstruation. 2. Mood swings and restlessness. 3. An excruciating, pressing pain in the lower abdomen starting 1 day before menstruation, which intensifies on the 1st day. 4. Bloating of the abdomen and constipation during menstruation, making it uncomfortable to sit for extended periods. 5. Her menstrual flow is excessively heavy for 3 days, characterized by ruby red blood with clots. Stressful periods are often accompanied by dreams of snakes. Remarkably, she found relief after being administered dynamized snake venom, suggesting an unconventional yet effective approach to her symptoms. She experienced vomiting 3 to 4 times on the 1st day of her menstrual cycle, along with twisting pain in the lower abdomen during the initial 2 hours of her period. Additionally, she felt the urge to defecate 2 to 3 times, though most of the time it was just an urging sensation. She would sit on the toilet in a squatting position, experiencing tingling in her feet, and often remained in this position for hours. The pain typically subsided after passing stool and vomiting. For 20 long years, she endured this condition, often rolling in bed, doubling over, and applying pressure with a pillow to alleviate the discomfort. The menstrual pattern of a 40-year-old woman is described as follows. A white, stringy, and transparent discharge resembling aloe vera gel occurs 18 days after the start of the previous cycle, lasting for 3 to 5 days. A week before her period, she experiences a sensation of her breasts feeling as heavy and painful as stones, to the point where touch is unbearable. This is accompanied by a discharge similar to colostrum exactly 1 day before her periods begin. Emotional symptoms include restlessness, anger, and depression preceding menstruation, with the depression intensifying during the menstrual period. The physical symptoms reported include extreme weakness, leg pain, and a sensation as if the vagina is being pulled upwards. All symptoms reportedly diminish within half a day after the onset of bleeding. I'm a 20-year-old woman and I experience this twisting pain about 1 to 2 hours before my menstrual period starts. The pain usually lessens once the bleeding begins, but it can last for half a day before subsiding by the evening. Sometimes I get dizzy and end up falling, and there are moments when I even lose consciousness briefly. The pain gets worse if my period arrives earlier or later than expected. And then there are these unbearable leg pains below my knees that make me feel like cutting off my legs. It's that intense. Oh, and during my periods, I also have these short episodes of anger. A 30-year-old female presented with symptoms including pimples appearing 1 to 2 days before menstruation, accompanied by anger, white discharge, and pain. She experienced a drawing pain in the lower abdomen as if being pulled downwards, back pain, and joint pain in her fingers and knees. These symptoms would start approximately 12 hours before her period, peak immediately before, and then decrease in severity once bleeding commenced. The pain, described as cramping and intermittent, would intensify after urination but lessen after defecation. The application of a hot pack and pressure provided relief. Additionally, back pain began with the onset of menstruation, and she experienced constipation during her period, feeling an urgency to defecate but unable to do so even with straining. Pain relief was achieved by maintaining tightness around the anus. Relaxation would exacerbate the pain. After receiving constitutional medicine, she showed improvement within a month and has been pain-free for 3 years since treatment. I have been experiencing this unique and challenging set of symptoms with my menstrual cycle for over 7 years now. Before the onset of bleeding, I faced chills, a chilling sensation that takes hold particularly on the left side of my chest and the back of my head, lasting for a day. During times of excessive bleeding, these symptoms intensify, revealing the unpredictable nature of my condition. I also feel a sharp, needle-like poking pain that travels from my forearms to my fingers, and from my legs below the knees to my ankles, but peculiarly, only on the left side. To compound my distress, a burning sensation plagues the left side of my tongue. And to add to my ordeal, nodular eruptions emerge on my face during my menstrual periods, serving as a visible reminder of my internal struggle. This story isn't just about the physical pain but the resilience in facing it, highlighting a need for understanding and support for women navigating similar challenges. I began experiencing back pain 5 years ago, which led to spine surgery following disc desiccation. 2 years later, the back pain returned, and another spinal surgery was suggested, but I declined. I started experiencing severe pain on the right side of my lower back before and during periods that I never had before. I otherwise always have pain on the left side of my lower back. Doctors dismissed my reports of intensified pain in the lower right back during my menses as imaginary, attributing the issue to weak bones. However, after receiving medication tailored to my constitution, I showed improvement within 3 months and am still undergoing treatment. The recommended treatments for dysmenorrhea primarily aim to alleviate symptoms through various methods, including prostaglandin inhibitors such as nonsteroidal anti-inflammatory drugs, NSAIDs, like aspirin and ibuprofen, to reduce pain, paracetamol for pain relief, oral contraceptives which inhibit ovulation, progesterone as hormone therapy, dietary adjustments to increase protein intake while reducing sugar and caffeine consumption, vitamin supplements, applying a heating pad across the abdomen, taking a hot bath or shower, abdominal massage, endometrial ablation, a procedure that destroys the uterine lining, endometrial resection, which involves the removal of the uterine lining, hysterectomy or the surgical removal of the uterus. These interventions do not address the root cause of dysmenorrhea, which nature has kept simple and could be effectively managed with a singular, straightforward treatment. This becomes apparent when a physician truly understands a woman's constitution rather than relying on a plethora of complex medications. Additionally, the potential side effects of hormonal treatments should not be underestimated. Unlock the healing wisdom of nature for enhanced well-being. Nature's impeccable balance provides all the essentials for our health, guiding us to remedies in sync with our inherent constitution. This is particularly vital for addressing prevalent concerns such as menstrual pain. Nature's remedies, especially when dynamized to tap into their energetic healing potential, transcend human understanding. These simple yet potent solutions align seamlessly with our body's natural healing rhythms. Understanding our unique constitution is crucial to harness these natural solutions fully. One of the greatest revelations to those trained in conventional medicine is the realization that nature has the capability to provide individualized remedies with the power to heal. This is where the role of constitutional experts becomes critical. With deep insights, they align natural remedies to our specific health needs, presenting a holistic health approach that neither technology nor conventional medicine can replicate. In a technology-dominated world, seeking out these experts and embracing the simplicity offered by nature can lead to significant healing and a more straightforward approach to health management. The wisdom of nature, unlocked by a constitutional expert, carves a pathway back to holistic health, offering a comprehensive strategy for curing not only menstrual pain but also a wide array of common ailments.
I am Dr. Sudhakar Reddy Tirupthi, specializing as a pediatrician and holistic practitioner with a focus on spiritual medicine named homeopathy. I extend a warm invitation for you to explore and subscribe to my channel, Try Incurable. Here, you'll uncover a treasure trove of unique and insightful health-related content that transcends traditional approaches. My channel is a source of invaluable information with the potential to significantly impact your life positively. Should you be inclined towards a holistic view of health, I urge you to subscribe to Try Incurable and share this resource with your network. I deeply value your time and interest in my approach to holistic health, and I sincerely thank you for it.